At an earlier meeting, a lot of the group expressed concern to do with the use of prednisone and steroid medication. And so now the research team has really picked that up, and they've been doing quite a significant amount of work, I believe, into researching the use of prednisone and its effects on, long-term side effects as well as short-term side effects, and how they can improve that kind of medication. So that's been a medication that I've been on since I was, I think, 18 months old. Now as an adult, I'm on and off it. And it's been the only thing that's really saved my life. But at the same time, it's a medication that does come with its, detrimental side effects as well. So I feel so grateful to the research team that is definitely one area that they've really heard people's concern with, and are really working to better that, I suppose you could say. Yeah.
We were putting in a major bid to the NHMRC around a new approach to management, and we were looking at a number of key areas, one being the oral corticosteroid use that Gabbi referred to. And that meeting that Gabbi talked about was us convening a group of people, and we presented our ideas for that grant to that group of people. We got valuable discussion, we got really valuable input from people's experiences, and we were able to weave that into our grant application, which ended up being successful. And I think that consumer involvement really kind of took that to a different level. We also have a consumer as associate investigator on that application as well. So that kind of demonstrates the real authenticity we have in terms of consumer involvement in research. So that's at one level. That's when you're planning the research, looking at co-design, but it doesn't stop there. We then are looking at other work, say when you start to design a clinical trial and you want people to come to visits for an X duration, X number of times. Getting that input from consumers who are living this, who are the people we're going to be recruiting to the research to do the visits, having them kind of having that expertise and inform us about the frequency of visits, the kind of duration of visits, what tests are acceptable, what tests wouldn't be acceptable, are really helpful in terms of your research then being more successful in itself, because you're going to be able to recruit people, retain people in the studies, and they're going to be more accepting of the interventions that you're proposing as well. So, there are other examples which I can continue to go on with, but I think there's just some key examples about how talking and working with consumer experts, I like to refer to our group as, because they're the experts in their healthcare. They're the ones that can help us in terms of developing our research. And we get such great ideas coming out of these consumer reference groups, things we've never thought about, things that really kind of have little light bulbs above our head thinking, oh, that's brilliant, why didn't we think of that? And that really kind of goes to show the strengths of this collaboration, I think.